that patients prefer AI that's been used together with the doctor. And that also means, okay, so together the doctor and the AI can make a decision. And I think it's also with somehow like this dignity part of it as well, because you don't just want a tool or technology to make a decision for you and for your health. So having this combination where the human is in the loop, and you know, because you trust the doctor because they've done, you know, they have had this education and they've done training with it, and the nurses, they also like have experience with working, blah blah blah. So you trust them, but you don't trust the tool. So again, back to the last question, but with the dignity as well, what I think both like patients or healthcare professionals or whoever needs to understand is that AI can also help detect things in a medical record, for example, that might be lost for the human eye. Because like I've worked in the hospital myself, and sometimes I just didn't have time to look through the hospital records of the patient I was going to talk to, because there were too many notes. I didn't understand, okay, what was really the whole picture here? I didn't get the whole picture, and AI can help you get that, so that you can actually have dignity. There was one, it reminds me a bit like of one experience of myself, for myself. I don't know if I told you, but like when I was a kid, my dad had a car accident. So I have a bit of trauma there. And then later, well, I had a clumsy dad, so he fell and he went into the IC again. And I was working in hospital back then, so my sister and I were going to go and see him. What I didn't realize is that he was going to be in the same position and like the same, like with a mask and everything as back then when I was a kid. My sister and I, we didn't realize this, so we kind of like we got back into this trauma, and the doctor who talked to us was more like, hey, get over it, you know, like he's just there, he's gonna be fine, like and it was a bit angry. But afterwards I'm like, well, if you would have had some type of like insights into his history, and maybe even bringing it back into how can you talk to, you know, the families that's coming, especially children, because we were kids, we were really kids when we had this car accident, we would have been met very differently, with more understanding, with empathy and compassion. And we were not the patient, I understand that, but having a tool that could actually highlight, hey, these could be issues, like these things are things to be aware of. I also understand that healthcare professionals don't get notified when you know, family or someone's coming by, and they can't do that. But it's just like having this more understanding of what has actually happened with a patient. This is not just someone who fell in and broke his jaw. This is actually someone who has a past, who's gone through this and this in the medical record. And that's just one example. And I understand like it was a traumatic experience, like from when I was a kid. But there are all these examples when things could have been highlighted in the medical record so that the patient can have a better experience, so that you would understand why a patient is actually reacting as they are reacting. Another story, when I was working as a nutritionist in the hospital, and this patient had a very hard, like she was malnourished, and wanted, like the doctors wanted to put in a feeding tube, but she had been sexually misused when she was a kid, like younger as well. So putting something down her throat and forcing her to feed, that didn't work. But people, like, they didn't have time to read her through her medical records and see that, like, it was kind of shown, okay, it was seen, but like understanding these links of how she's reacting today. And there's so many ways of how this dignity could have been improved, and how you put this, like the patient in the focus, and how technology can actually help us with that. It's either that, or that we spend so much time just reading through these medical records and understanding these links ourselves.